Hello. Today we are going to talk about Chapter 4, Basic Principles of Healthcare, as well as the nature of rights in ethical discourse. Let's get started. So, these are really important principles that you're going to want to remember throughout the rest of the course. So make sure you pay attention to the next few slides. These basic principles are what healthcare workers should use when determining an ethical course of action. So when you're asked to, think about the correct, actions in a certain situation, you want to think about these principles that we're going to talk about now. Autonomy, veracity, confidentiality, beneficence, non-maleficence, justice, and role fidelity. And we'll go through each of them individually to give a definition and some examples. So autonomy is personal liberty. It's when an individual has the freedom to choose their own decisions. Patients, in our case, patients should be honestly informed about their condition, and they should not be forced to make decisions without the time and space to consider their options. The idea of informed consent comes from this principle of autonomy. A patient should be provided with information about surgery or medication before agreeing to it. And autonomy means that a patient can refuse treatment, and healthcare providers must respect that decision, even if the healthcare providers think the patient is making the wrong decision. The only time autonomy should be limited is when a patient cannot fully understand their situation or is not, conscious and not able to participate in their decision making. Then they are going to have, a power of attorney or next of kin or someone else make those decisions for them. But that is the only time autonomy should be limited. The next principle is veracity. And what veracity means is truthfulness. So on both sides, people should be truthful. The patient should be truthful and the healthcare provider should be truthful. But because of their position, the healthcare provider has the greater standard. They are required to be truthful at all times. There are very, very rare cases where it is okay for a healthcare provider to lie to a patient. But again, they are very, very rare, and that should be avoided at all costs. If you are tempted to lie to a patient, you should really consult with another healthcare provider to discuss the situation and figure out a way to proceed where you don't have to lie to the patient. Beneficence, this means an act that benefits someone else or an act that is good. Patients are under the assumption that healthcare providers are working for their benefit. So patients are assuming we are working for their good, and we want to carry out that. We always want to be working for the good of the patient. Sometimes it may be beneficial to do nothing for a patient. That might be the best course of action. But again, it depends on the patient and their decisions. So for example, performing CPR on a patient who is terminally ill may not be beneficial to the patient in that case. Even though they may be resuscitated, they might have their bones broken, and the CPR may only prolong their suffering. But in those cases, it's important to know the wishes of the patient or the patient's family, depending on who's in charge. If the patient is awake and able to make the decision, the patient should make the decision beforehand, and if not, the family is the one to make the decision. Non-maleficence. This is the opposite of beneficence. When beneficence means good, so we should always do good, non-maleficence means we should not do harm. So we should not do anything that harms our patients. Now, this doesn't mean that there's not going to be side effects. We know that often medication or treatment will have a side effect. But what we do is we decide if the benefits of a treatment outweigh the side effects. And if that's the case, then we can give that, medication or that treatment to the patient. Another thing to think about is that a healthcare provider should never suggest a medicine or treatment in order to get the negative effect. For example, morphine is a pain reliever that also slows breathing. A healthcare provider can suggest a terminally ill patient take morphine for their pain. They should not suggest the patient take the morphine to slow breathing and ultimately die, because that would be considered doing harm to the patient. Confidentiality. This is the foundation for trust between the healthcare provider and the patient. If a patient believes that you're going to tell all their secrets, then they are not going to tell you the truth, and they are not going to disclose all the important information that you need to know. So this will lead to suboptimal care, which means they won't get the care that they need. Healthcare providers should never disclose information about a patient unless it is medically necessary. Sometimes there are funny stories or silly things that happen, but we should not talk about our patients and break their confidentiality. Justice. Justice means fairness, and there are 3 types of justice that are talked about in the textbook. The first is procedural justice, which is due process. And in the United States, we have a trial system where you are innocent until proven guilty, and there has to be a whole trial that happens before you are determined to be guilty. So that is our procedural justice in the United States. Then there's distributive justice. This is when you have a small amount of something and needs to be shared with the group. So for example, heart transplants. There are many people that need heart transplants or other organ transplants, and there are very few organs available. So how do we decide how to distribute those resources? Another example would be during the COVID epidemic. During the beginning part, we were short on respirators, or short on machines in the U.S. that could breathe for people, basically. And so, it had to be determined who would be put on those types of machines and who would not get access to those machines, because there were only, a certain number of machines available. Compensatory justice is when someone seeks money for a wrong that has been committed against them. So if a patient is suing a hospital because they had surgery and the surgeon left a pair of scissors in their abdomen, that would be considered compensatory justice, when they're looking for money to kind of fix the problem or to pay for the problem. Role fidelity is another of the ethical principles, and this is the requirement that a healthcare provider only practices the role that they are assigned, trained, and licensed for. Another way to say this is that providers must only perform tasks within their scope of practice. So a dentist cannot perform heart surgeries, a radiologic technician cannot pull a tooth, and you can think, I'm sure, of lots of other examples. But healthcare providers are a member of a team. They must perform their job for the team. They cannot do someone else's job. Okay, so those are the ethical principles, and you really want to know them by heart as we go through the rest of this book and the rest of this class. The next section is about the nature of rights. And we want to think about what are rights, first of all. They are something that must be protected and respected. And another term for rights that the textbook uses is justifiable claims. So if you have a right, then others have the obligation to respect that right. But rights can often compete with another. For example, I may have the right to express my opinion, but you have the right to walk away from me if you don't want to hear what I have to say. The next part of the book, textbook talked about a right to health care. And in the United States, we don't have a overarching right to health care. We have established that individuals have a right to emergency care. So if someone comes to the emergency department, they must be treated with their emergency. But we do not have a overarching right to health care. You may have a disorder or condition, and you may not be able to afford the treatment for that. And in the United States, we accept that you may not be able to afford the treatment. We do have subsidized health insurance for those who can't afford it on their own. So if you cannot afford to purchase health insurance, you can typically get it through the government at a lower cost. But there still may be, deductibles that you have to meet in order for you to get your health care covered. So we do not have any greater guarantee than these in the United States at this time. Other countries do have a guarantee of universal health care, but we do not. So the book discusses the idea of natural rights. And these rights are seen throughout a variety of different religions and cultures, and they can basically be summarized by the golden rule: treat others how you would want to be treated. There are, when we're talking about rights, positive and negative rights, as well as legal and moral rights. So positive rights are things that to which every person is entitled to. So there are something that you should get: food, water, and shelter. And we may also think about adding healthcare to that list of things that you are entitled to as a person. Negative rights are things that mean you're kind of protected from other people doing to you. So we have the right to life, liberty, and the pursuit of happiness. And what that means is that nobody else can take our life from us, or nobody else can take our liberty, which is our freedom, from us. So it's something that we have, and people can't take that away. That's why it's considered a negative right. Then there is the idea of moral rights versus legal rights. We may believe, for example, that everyone deserves food and shelter, but our society does not allow for stealing in order to make that happen. So if you are a person who is without a home, and maybe there's a home that you find that nobody is living in, our society does not allow for you to live in that home, even though no one's using it, because we consider that stealing. So sometimes the moral rights are in conflict with legal rights. Just like we consider it a moral right to have food and water, but we don't, again, we will not allow someone to steal in order to get those things. Even if they didn't have any other access to them, our society says that stealing is wrong, even though you might be stealing something that you absolutely need. Okay, I hope that these slides were helpful to you. And let me know if you have any questions. Make sure to read the textbook carefully, and good luck.